All right, we will start with our presentation. Thank you all for joining us. Um, the reason we are all together in this webinar is because all of us participants are, we are parents of children with special needs, and you have been looking for solutions. You've been looking for answers. You've been looking for ways to help our children with special needs, especially those on the autism spectrum. And I'm here to share with you some very exciting news about a whole lot of developments that have happened in the past couple of years, in particular to the work that we do. I'm Dr. Alok Sharma. I'm primarily a neurosurgeon with a special interest in regenerative medicine for neurological conditions. So we will now look at what we call the 360-degree approach to the management of autism. Of this, the first 180 degrees is diagnostics, investigations, trying to understand what is happening with our children. And the remaining 180 is what we can do to correct it. So the first thing that is noteworthy is the significant increase in the incidence of autism. In 1995, exactly 30 years from now, 1 out of 1,000 children had autism. And today, it is 1 in 31. So from 1 in 1,000 to 1 in 31 is a very massive increase. It's huge. And which is why a few decades ago, where nobody had heard of autism, today everybody knows somebody whose child has autism, and we all are actually part of the families who have this. So you're not alone. We show you this graph is from the USA, the American CDC, and it's the most accurate statistics in the world. This means that there are 70 million families. You are one of 70 million families who are affected by this problem.
Around 1 year.
So before we begin, I'm going to share with you clips of a few parents of what their journey was like, what their thoughts were like before they took our treatment. And then we'll go back at the end of the presentation. We'll hear the same parents later after they have taken our treatment.
Around 1 year, she had speech, but at around 1.5, she went mute.
When she was 1.5 years old, she was not giving an eye contact, not mixing with the children's, and not replying to her name. So that actually triggered something is wrong. Ian was not at all talking. Just everything is fine.
His focus is very poor, but very focused.
My son was completely speechless.
Never see no. You talk, then you regress.
If you cannot speak, it's not safe. Even if someone is bullying you, you cannot even say and ask for help.
Challenges were really in his ability to listen to longer instructions, his ability to sit, process that, even talk. Some of the kids stick toes. I would see it like that.
Noticing more and more of abnormal symptoms, which was hard to digest.
Was not able to control himself in terms of toilets. He used to wear diapers. He wasn't able to, very picky eating.
Whenever you open the door, we had the threat of he running away. So we had to keep him contained. So unpredictable behaviors.
He was running away. He wasn't sleeping. I would stand up the whole night holding him, and he would cry if I put him down.
We took her to the pediatrician. Then we got a shock. Oh, there she is suffering from autism.
When I was told about the diagnosis, first I saw the end of me. I couldn't handle it.
It's like we lost our son. He was here with us, right with us, and he is not even responding to his names.
So then what is the solution? You have to go to therapy and all.
We had several years of therapy. That did not change much for me for 8 years.
Therapies was not making any changes. Pediatricians and all say that, oh, nothing can be done.
When I saw Dr. Alok talk about the amazing results that he's seeing based on stem cell, I don't want to wait. My child is losing his time.
So this is the story of parents, and this could be your story.
Around 1 year.
So this is the present conventional treatment. You notice symptoms in your child, you go to a pediatrician or a psychologist, you're given a diagnosis, which is a shock for most of you. You're told, take rehab. maybe you're given some medicines for hyperactivity. No scanning of the brain is done, and you're told there is no definite treatment. And this is what you have been living with just now. However, what is the new approach? And this is our approach. After the diagnosis, we do detailed brain imaging, which includes MRI and PET-CT scan, also an EEG. We do very special, routine, and specialized biochemical investigation. We look at the vitamin D, vitamin B complex, folic acid. We look at a whole lot of tests which are not done conventionally. We do genetic testing to see if there is a gene mutation that is affecting folic acid absorption. We check the entire gut. We do a gut microbiome test. We have a comprehensive rehab program. And then we do cell therapy. We have various integrative therapies like hyperbaric oxygen ozone. We do micronutrient supplementation. We have been using Leucovorin for the last 2 years. And we do gut cleansing. So there is so much available, both in the diagnostics as well as the treatment space, which has not been offered to the majority of children. And this is what is new. So let's just watch this video. This is a video from the United States of America, where President of the United States, Donald Trump, the Health Secretary or Health Minister of America, RFK Jr., and the US FDA Commissioner are talking about autism.
Been waiting for this meeting for 20 years, actually. And it's not that everything's 100% understood or known, but I think we've made a lot of strides as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. It's 1 in 12 or 1 in 31. And now we're at the level of 1 in 12 in some cases for boys, 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%.
So autism for pregnant women, infants, and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism.
Today, the FDA is filing a Federal Register notice to change the label on an exciting treatment called prescription Leucovorin so that it can be available to children with autism. You know, autism may also be due to an autoimmune reaction to a folate receptor on the brain, not allowing that important vitamin to get into the brain cells.
So we heard Donald Trump talking about the increased incidence. We heard of RFK Jr. talking about the folate mechanism, and we heard the FDA Commissioner talk about Leucovorin. So a lot of you parents have questions about this, and so I'm going to clarify some of these doubts. So folate is basically one of the B complex vitamins, basically B9. It in our natural food, the way we take it, in our supplements, synthetic supplements that we take, it is in an inactive form called folic acid. All right. So vitamin B9, when we call it folic acid, it is inactive, and that is how we take it. For the brain to use it, it has to be converted into something called methylfolate. It must be made something active. So I'm going to talk about these things. So folinic acid or leucovorin is actually an active form of it. So just to define the words. So folate deficiency, when it happens in the brain, especially the developing brain, it damages some parts of the brain, and you get what is called cerebrate folate deficiency. And this results in problems with speech, social interaction, hyperactivity, the classic signs of autism. So to be able to compensate this, now there is a new drug which the US FDA has approved, but which we have been using for the last 2 years. The US FDA approved it just last month, but we've been using this for over 2 years. So this is an active form of B9, and I'll explain to you how leucovorin is beneficial as compared to the conventional folic acid. The benefits are what we've noticed in the last 2 years. When we combine leucovorin with our stem cell therapy, we find that the speech improves much better, social interaction is better, attention and learning is better. However, it does lead to behavioral changes, and some kids do get a little aggressive. they can have some GI issues and sleep disturbances as well. So there are benefits that the speech improves, but there are some side effects like behavioral changes. And we've been using it since 2004, and we've seen definite improvements in speech, behavior, and understanding. Now, in the US FDA commissioner also referred to as an autoimmune reaction. These are technical terms. I don't want to, confuse you with too much technical stuff. But I'll subsequent to this just try to make it as simple as I can. There was also talk of whether paracetamol taken during pregnancy can be a cause. We don't have very much data on this. So let's look at the science. So we will look at the genetic findings, biochemical findings, gut and brain. So these four things. Now, what I'm going to discuss now is our research done at NeuroGen on genetics, on biochemical findings, on the gut, and on neuroimaging. We're going to look at all of this and see how we can help our children. So the genetic findings. What we have found is that there is a particular gene called the MTHFR gene that converts the inactive folic acid. Remember, we had looked at folate. I said folic acid, the way we take it is inactive. It's called folic acid. So the way we take it in our food, the way we take it in our supplements, we take vitamin B9, folic acid, but the brain can't use it. To be able to use it, the inactive form has to become active. So this inactive form has to become active, which is called MTHF. Now, there is a gene that makes inactive active. This is the gene's name, MTHFR. This converts the inactive form to an active form. In the active form, the brain can absorb it. I know it's complicated, so I'm going to repeat it one more time. We have many vitamins, A, B, C, D, you know all those vitamins. In the B complex vitamin, there is one vitamin B9. It's called folic acid. We take it in a form, in our food, in our drugs, in our supplements, in a way which is inactive. In our bodies, folic acid has to be converted to MTHF, that is the active form of B9. Once it converts into this, the brain can take it. The brain cannot absorb inactive folic acid. There is a gene that converts inactive to active. And what we have found is that now in those patients where the gene is defective, what happens is now the inactive does not become active. And so the brain is starved of a very important vitamin that it needs for its development. And this results in cerebral folate deficiency. Now, what our data shows, and this is our research, is that 73% of our children, you're not going to believe this, so 3 out of 4 children with autism have this gene defect. 3 out of 4, 73%. This is our data. What does it mean? It means in these children, we are giving them vitamin, the brain can't absorb it. Okay. So the brain is deprived of this vitamin because in 73% of the children. And so in them, what I said, because in 73% there's a mutation, inactive does not become active. And because it doesn't become active, the brain is starved. I'm sorry, I'm repeating this 3-4 times because it's technical and I want all the parents to understand this. Yeah. So this is our data. So what's the solution? The solution is when instead of folic acid, when you give it as folinic acid or leucovorin, it bypasses that, it sort of completely bypasses that. So it doesn't need that particular gene. In other words, the conventional folic acid when we give, that is what is available in all the syrups and all the tablets and what was given to all the mothers during pregnancy. The body is not able to absorb it. I'm not talking in too much detail about folate receptors and all of that. It's very technical, but for those who may be interested, for anything to enter the cell, it has to go through something called a receptor. A receptor is like a gate. It lets things come in. Now, autoantibodies are things which block that gate. So once this gate is blocked, now this cannot go inside. So leucovorin bypasses that. It completely bypasses that, and then the brain gets MTHF. It's like the regular door is closed, and you have to find another door to enter. That other door is leucovorin. I hope you understood. If you're not, I'll repeat it again at the end. So there are lots of research. So our data showed 73%, but worldwide it shows that again 75% have this problem. The new biochemical findings. So this is again our research. We have found that in the brain, there are low levels of these particular neurotransmitters, which are dopamine, histamine, GABA, tyrosine, phenyl. These are all technical names. But we found high levels of other receptors like serotonin, glutamate, and epinephrine. Again, this is low levels and high levels. It's technical stuff, but I'm showing you all this to let. This is all our research. What I'm showing you now is not from any textbook. It is research that we have done to understand what is going on in the brains of our children. Like, because unless we understand the problem, we can't fix it. So we've also found the vitamin D is low in almost half our children, 46%. So 1 out of every 2 children has low levels of vitamin D, and vitamin D comes from sunshine. The sun, when it shines on our skin, it produces vitamin D. Our skin produces vitamin D, but today kids don't go out in the sun. They don't play. In some parts of the world, there are long winters, so there is no sun. So, but vitamin D, and this is very easy to correct. It's very easy. Just give supplements. But what we found to our surprise is that vitamin B9, folic acid, was high in 81% of our children. High. Now we keep thinking, let's keep giving vitamins, it'll help. But when you give folic acid in children who cannot absorb it, the levels become higher, and this causes damage. So low vitamin D, this is what our data shows us. We've also tested the gut microbiome, and what we found, we know that 70% of autism kids have a problem in the gut, because of which you can have behavioral issues, digestive issues, immune issues, and neurotransmitter issues. So this is what we found. In our gut, we have 2 types of organisms. Good guys, that are the probiotics, and the bad guys, the negative things, negative infections. To our surprise, we found, and you can see the percent, so all what you see listed are the good probiotics. And they are absent in more than half the children. They are absent. They're not reduced. They're absent. They're just not there. So there are no good bacteria in the brain. Same thing here. This is, other probiotics to show in what percentage they are absent. But on the other hand, the bad bacteria, the bad infections, they are very high. 50% of our children have E. coli, 50% have Shigella infection, 30% have fungal infection, 43% have. So there's less of good and there is excess of bad bacteria in the gut of our children. So this is again to show you, various vitamin and neurotransmitter level data. And it's all a bit technical, so I'll just move ahead. Then also there is brain imaging. So we do 2 kinds of imaging. We do PET-CT scan, we do MRI scan. This is the PET-CT scan is a color scan. And what we have found is the small brain or the cerebellum and the entire, so whatever you see blue here is damage. All this is damage. Ideally, all this should have been green. So these are the parts of the brain. They are technical terms. Cerebellum is the small brain. The other amygdala, hippocampus, parahypothalamus, and the medial part of the brain. Just behind and above the ear. So all these things are damaged. And we were the first to show in more than 8,000 children of autism. We've done this scan in 8,000 children, and every child on the autism spectrum has a similar kind of damage. As part of a research project, we looked at some other neurotypical kids' brains. None of them had this. So we were the first in the world to show that there's a part of the brain that's not working in these kids. But interestingly, we found there is a part of the brain that's working more. So in particular, the visual area, as you can see here, and some parts of the front area, the intelligence area. So that's why they're called visual thinkers, because the visual brain is more active than your and my brain. So there is some bad news in the sense that there's a part of the brain that's not working. But there is good news that there is a part of the brain that's working more than normal. And all this work is published in a prestigious journal, the World Journal of Nuclear Medicine. So whatever I'm talking about is published in medical journal. This is our paper, which shows the baseline pattern of metabolic changes in brain of children with autism. What we found to our surprise is that the brain activity keeps on decreasing with the years. So if you see a 2-year-old child in kids on the spectrum, in kids, neurotypical kids, it is shown that the brain activity keeps on increasing with age, up to 10, and then, it goes on up to 15. In kids with autism, it keeps on decreasing. Now, why is this important? See, if you treat early, let's say you treat here at around 5 years, you have to only bridge this gap. But if you treat the child at 15 years, you have to bridge this gap. So the gap is bigger. That is why it's very, very important that we treat early. We don't wait, because the earlier we treat, the better results we get. We've also done MRI brain scans, and so you all may be aware that we have a right side of the brain and the left side of the brain. And there is a connection between the two. It's called the corpus callosum. We found that kids on the autism, this is smaller. The volume that means the bridge that connects the right and left is smaller than otherwise. So this is the brain MRI, and again, this is published in a scientific paper. This is a paper published by us, which shows how the corpus callosum develops in a different way. So what is our data showing? Our data shows that 73% of kids, they have a MTHFR gene mutation. So they can't absorb folic acid, but we are still giving them folic acid. So in 81%, their levels are higher. And partly the reason could be that in 1998, WHO said that we should give this folic acid to mothers. And it also became in the US mandatory to supplement with maize and wheat during, this was WHO says to give it to mothers during their first trimester. This was to prevent another problem called neural tube defects, which it very successfully managed. But it is believed that this may be the cause of autism. So there are several factors for autism. I won't go into it, from heavy metals to vaccination to early medications to exposure to chemical toxins to mobile phone radiation, older age of parents, nutrition deficiencies, the health, both emotional and physical health of the mother, genetic factors, a stressful family life. But this is a separate topic all by itself, so I'm not going to go into this right now. In 1998, a question very often parents ask us, do vaccines cause autism? The thing is, we don't know for sure, because in 1998, Andrew Wakefield published a paper in The Lancet, said that there was a link between autism and MMR. However, there was a vicious backlash from the medical community, and then this paper had to be retracted. And subsequently, papers have shown that maybe there may not be. So there are several articles that show that there is no connection. However, the jury is still out on that. So what is the solution? So what we do is, so what I showed you right now were the investigations. In the majority of you, this has not been done. In none of you, I'm sure a PET scan has been done, like in nobody. MRI scan, maybe a few, but gut microbiome, not done. Looking at vitamin D, folic acid, not done. So my first step is, the genetic testing, majority of you, it's not been done. So when you come to us, the first thing we do is do all of this and tell you exactly what is going on with your child. Now, just diagnosing is not enough. We have to treat it, right? We don't want to just know the problem. We want to fix the problem. How do we fix the problem? So there was an older belief for 150 years that once the nervous system is damaged, nothing can be done. But now there's a new thinking that you can repair the damage through cellular replacement and repair. So we'll now talk of cell or stem cell therapy. So what we do in cell therapy, we take healthy cells, good cells, and we replace the damaged cells. So that's what cell therapy is about. So I give you an example. This is say a person with a fracture of the leg. You can see this bone is fractured, this bone is fractured. And I ask you, if you had a fracture of your leg, would you be doing exercises, physiotherapy on a broken bone? No, none of us would. What we would do is we would go to an orthopedic surgeon, get it fixed, get the fracture fix, and now do therapy and exercises on this. But with our children on autism, we do exactly the opposite. Here's a brain that is hypometabolic, not working, and we are forcing our child to do therapies on a brain which is not working. Okay. Now, what if you could? So here you can see there's nothing. Here's the same patient, and you can see that green has become blue. So what if we repaired the brain and now did therapy? We would get much better results. So worldwide, there are several papers. There are over 47 international papers. So it is not something isolated. There's several countries have been doing this work, showing that. So 47 papers that show the benefits of cell therapy in autism. So how does cell therapy work? The first thing about stem cells is they multiply. You take a single stem cell and you can make thousands of stem cells over a period of time. You can convert them into millions of stem cells. So first is the multiply. Second, most important, the same stem cell can become a nerve cell. It can become a muscle cell. It can become a heart cell, depending on where you put it. You put it in the brain area, it becomes a nerve cell. You put it in the muscles, it becomes a muscle cell. So the same cell becomes any part of the body. It also improves the blood supply, gets fresh blood towards it, so healing happens. And it releases certain positive chemicals, which result in, again, the healing process. So the ability to multiply, to convert into any cell type, improve the blood supply, and release positive hormones. Together, this results in repair, regeneration, and replacement of damaged tissue. So that is what cells do. This is just to show you medically what cell therapy does. These are the medical terms: angiogenesis, paracrine effect, anti-apoptosis. So this is how stem cells work. They reduce the inflammation, improve plasticity of the connections between the nerves called synapses, protect the cells from dying, release growth factors, and all of that. There are two types of stem cells. One is when you take from the body, put it back in the same body. The other is when you take from a donor. So we use autologous. We take from the body, put it back in the body. We don't believe in use of donor cells. How do you inject them back? You can inject them into the lower back, so that into the fluid in the lower back, that fluid takes it to the brain. You can give it intravenously as an injection. You can put it in the muscles, in the arteries. You can give it through the nose, or you can put it directly in the brain. These are all ways in which it can be put. So how do we do this? We take a needle, put it, this is the bone above here, the pelvic bone. We put this needle into the bone and take out the bone marrow. This takes about 15 minutes. The child is asleep. There's no risk or damage whatsoever. There's no pain later. What we have taken out, we take to a laboratory. We filter it, separate the stem cells. And once the stem cells are ready, with a very thin needle, we inject it into the lower back, because the lower fluid from the lower back then takes it to the brain. So let's watch a small video of how it is done. So here's the bone marrow aspiration. You can see the cells are coming out. We take it to the laboratory. We separate, and with a very thin needle, we inject it back. So I'm going to show you this video again. 3 steps. Step 1, taking out the bone marrow. The child is sleeping. Step 2, taking the bone marrow to the laboratory and separating the stem cells in the third step is injecting it into the lower back, so it goes straight to the brain. We have, worldwide, there are different countries who've published, but we at NeuroGen were the first to publish this work. So the world's first publication on cell therapy in autism was published by us. The second paper came from China, third from Italy, fourth and fifth from the US. The sixth paper again was ours. The seventh and eighth paper from Vietnam, Iran, and the ninth from the US. So we are the first to publish this work. This is the first study we published in 2013. This was published in the journal Stem Cell International. It was a small group of patients, 32 patients only, and we showed a lot of improvements. So above you can see the percentage. 91% of the children improve in social relationships, 56% in emotional response, 78% in speech language, 66% in behavior, 44% in sensory issues, 71% in hyperactivity, 71% in attention concentration, and 70% in eye contact. These are amazing improvements from just one single treatment. And this is published. So this was a second paper. It was published in a very prestigious journal, American Journal of Stem Cells. And this was published. This is a bigger data of 254 patients. Again, you can see all the 95% of the patients improve, which is a lot. And you can see all the symptoms: social interaction, eye contact, attention, concentration, aggressiveness, all these symptoms, they improved. And but here's what is most interesting. What we found is the improvements were age dependent. So below 5, we had a 97.7, close to 100% success rate. Between 5 to 10, it dropped to 94%. Between 10 to 15 to 94, and 20 to 24, 91%. So with age, the improvements keep on declining. And here is the objective proof that it is working. So this is the scans before. You can see this is the damage before. The whatever is blue is the damage before cell therapy, and after cell therapy, you can see it's all improved. See, this has improved significantly. This is almost gone. Here only little bit is left. So this is the real proof that the damage in the brains of children with autism can be reversed. I'm showing you 1 or 2 slides. We have more than 8,000 before and after. I'm going to repeat that. We have more than 8,000 before and after. And in every child, we've shown that the damage does improve. All right. So this is done on a machine called a Siemens machine. You also have a machine called GE, General Electric machine. And here again, you can see the damage before, and you can see afterwards it is improved. So this is objective proof that the damage improves. And this is our latest study. This is the world's largest study, published and accepted for publication in 2025. This is 1,011 patients. This is the world's largest study. And, we showed again, you'll see all the symptoms above. You can see the percent, what percent of patients that improved. But attention, concentration, command following, eye contact, setting, tolerance, social interaction, hyperactivity, communication, speech, stereotypical behavior, aggressiveness, self-injurious behavior, all improved to the percentages as above. The scales, international scale for autism and the CAR scale for autism, the Indian scale and the international scale. So ISA is the Indian scale for autism. And what we have found is that there is a significant improvement in that. That means on the ISA scale, out of 1,100, 859 improved. On the CAR scale, 867. So these are objective studies to show improvement. And here again, we saw a similar trend with increasing age, the results become lesser. So here again, before cell therapy and after, and you can see the difference. So now let us hear the same parents who we had heard before. We will shortly hear their views on what they felt. Now, I mentioned NeuroRehab only to highlight the importance of NeuroRehab. You all know about it. So if the brain is a computer, computer's got hardware and software. The stem cells only repair the hardware. Software has to come from rehab, from therapies, from teaching at home, from teaching in schools. So, there are different types of rehabilitation, and we believe that you need all of them. In some parts of the world, you only get ABM. In some parts of the world, you only get speech therapy. We believe everything has a role. So these are all the departments at our hospital. And because rehab, it improves the cell integration and survival and the blood and oxygen supply. So we must combine rehab with cell therapy. Now, integrative therapy. So we have something called hyperbaric oxygen. On the left, you see this chamber. You can see there's a chamber. The parent goes in with the child. We shut it. What it does is it improves the oxygenation, immunity, brain function, metabolism, energy levels overall. So this is a standard chamber. We have 3 of these, and they work from 5 in the morning to 2 in the night. So there's a very big demand for hyperbaric oxygen, and it's very, very helpful. Now, how does hyperbaric oxygen work? I'll explain to you. Right now, all of us, we are breathing oxygen at 1 atmosphere. And at 1 atmosphere, when we breathe oxygen, from our lungs, it goes into the blood. In the blood, only the red blood cells, this is called RBC, only the hemoglobin in the red blood cells can carry oxygen. There is no oxygen in the white blood cells, and there is no oxygen in this whole liquid, zero oxygen. But when you put it under pressure, the oxygen enters the liquid. So now every nook and corner will get a supply of this good oxygen. Then there's something called ozone therapy. So oxygen is O2, ozone is O3, and we found it has a lot of benefit effects on oxygenation, inflammation, immune systems, and release of growth hormones. And we can give ozone through the ear, we can give it rectally, we do ozone cupping with it. So the gut is again very, very important, and we do a gut microbiome test like I showed you. We identify the negative pathogens and we kill them. Okay. So this is what we do. So we identify, then we kill the negative bacteria and we replenish the positive ones. So the gut detox plan has a lot of benefits, because when the gut is clean, the whole body is clean and the brain is clean and the inflammation is much less. About diet, I don't have to talk to you much. You all know it, that we should have probiotics, prebiotics, we should have ketogenic diet, and we should have gluten and gluten-free diets. Foods to avoid are definitely sugar. So sugar is one thing that completely makes the brain go crazy. So no sugar, no pesticides, no additives. Try to avoid genetically modified organisms or inorganic processed food and hard to digest starches. So this is diet advice which your dietitian will give you. Then we do micronutrient therapy, in the sense we supplement vitamin D where there's deficient. We use, instead of folic acid, we use folinic acid. And so the treatment of autism is multidisciplinary. You need, rehab, diet advice, hyperbaric oxygen, cell therapy. All of these are required together. So we heard a group of parents talk in the beginning. Now let's hear their experience after the stem cells.
When we came here to NeuroGen, she was totally non-verbal. She had no speech. Immediately after the first shot of stem cell, that's when she started now having one word.
And 2 weeks from that, he was using single words like
C4.
magically the water came out from the mouth, mama came out from the mouth.
Therefore, I remember the first day she called me mom, I cried. I cried because it was so emotional.
Within about like 40 days, a remarkable improvement. Her eye contact is fabulous. She started sleeping on the eye. That is wonderful.
Biggest game changer for Prithvi is his expressive language, his speech. He started speaking more. He even started telling us what's going on in school.
He's able to listen, he's able to understand more, and he's able to learn new things.
So after stem cell, what I saw was he was able to read sentences in his mind.
Started responding to her name.
Is Ariana a big?
No.
Ariana is that?
Yes, I'm good. Yeah.
Then his writing has improved. He can read single word to sentences.
My girl finally she would speech. Please give me food. Can we go for a shopping?
Cranberry.
And orange.
Orange.
And mixed fruit. Mixed fruit.
Right. Now he's able to put things in sentences. Let's put on our shoes. Let's go to the car. Let's go to the plane. Let's go home. You feel now, yes, you got your life. Taught him my phone number for emergency purpose. I also taught him the address. He's able to tell me full address, and he's able to write it down, so that if anything happens, he's able to say my phone number.
He understands the emotions. If you're happy, he's happy. If you get upset, he knows you're upset. I've seen a lot of huge differences. It's like giving a second life to a child.
So that was the reaction of the parents before and after. We'll briefly look at cerebral palsy, where the damage is much more severe in the brain. You can see the damage is much more severe, because of which there's weakness, tightness, stiffness in the body. And there is no treatment except for certain muscle relaxants, pain relief, etc. There are some procedures which can also be done. But after a stem cell therapy, you can see this is the damage before in a CP child. And 6 months later, it's totally gone. So cell therapy is very useful in CP as well. and our work is published in this scientific paper. This is our data from 40 patients. You can see everything from oromotor skills, speech, neck holding, sitting, standing, walking, muscle tone, all of these things improve. So, and here you can see above, the blue is damaged, and you can see below, there is no damage. What are the scientific basis of our work? All our work is published in peer-reviewed journals. We have over 110, exactly 112 papers, 17 of which are on autism, 15 are on cerebral palsy. So these are our 17 papers on autism. We've written chapters on textbooks in autism. We have published several books, and all these books are available free. We have books on stem cell therapy. We have books on autism, books on CP, books on muscular dystrophy, books for rehabilitation therapists, and all these books, hard copies as well as digital copies, are available without any cost. We have treated 16,000 patients from 103 different countries, from all the 6 planets, all the 6 continents, sorry, not planets. We've had patients come to us. We work out of 2 buildings. One is a 11th floor building in Nerul, Navi Mumbai, and the other is a 4th floor building, which is just close by, 10 minutes away. So before I end, I'd like you to hear the views of leaders of the 2 biggest democracies. So the Prime Minister of India and the previous President of the United States, what their views were on stem cells. The Honorable Prime Minister, our Honorable Prime Minister Sri Narendra Modi ji, he has written an introduction for a book that I have written. It's such a distinguished honor that Narendra Modi ji has written a forward message for one of my books. And this is myself giving Modi ji a copy of that book. And let's hear what he had to say. He gave a very intense speech in Parliament about stem cells. Let's hear that.
मैं जापान गया, तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी खोज हमारे काम आ सकती है क्या। हम गए तो वहां गए, उनसे चर्चा की, और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So that's the Prime Minister of India talking about stem cells. Now let's hear what the previous President of America.
Today, with the executive
Barack
order I am
Obama
about
had
to
to
sign,
say.
we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So just to let you know that all the work we do is done with the permission and oversight of a health ministry registered institutional ethics committee. So my conclusions are that today we have new imaging, which gives us greater information about which parts of the brain are affected by autism. We have new biochemical investigations that tell us what's going on in the brain. We have multidisciplinary treatment. We have neuro rehab, cell therapy, integrative therapy. So there is a lot that, and all these things are very safe and very effective. So we have to note that this is not a cure for autism or CP. It has to be combined with rehabilitation and conventional treatments. What we find is the best results come when parents accept the child the way the child is. There is a complete understanding of what's going on. The whole family works as a team. When the day is structured very well, when we combine cell therapy, rehab, and micronutrient imbalances with integrative therapies, when we do all of this, we get the best results. So this is my concluding slide that today what is happening is diagnosis, rehab, some symptomatic treatment, no investigations, no definitive treatment. What we offer after diagnosis, investigations, MRI, PET, CT scan, specialized blood tests, genetic testing, gut microbiome testing. So all that testing is done before. And the treatment, rehab, which is comprehensive multidisciplinary cell therapy, oxygen-based integrative therapies like HBOT ozone, micronutrient supplementation, leucovorin, and gut cleansing. So I'd like to thank you for your attention. If you have any questions, I'm happy to answer them. I don't know how I will. If you have any questions, question कर listing. I am waiting to. Just give me a few minutes. I'll answer any questions that you have. All right. If you have any questions, all right. So there's a box. You can ask me whatever questions you have. I'll be happy to answer any questions. All right. Let's see. So then it would be wise to first do donor cells so that they can heal the internal body, like inflammation in the body and the gut. And after 2 rounds of donor cells, then come into NeuroGen and heal the brain. Please clarify. See, the thing about donor cells is that we inject them IV. They go to different parts of the body. They don't repair the damage in the brain. They don't repair the damage in the brain. And the stem cells will not, I'm repeating very clearly, will not go and repair the gut damage. The gut is full of infective organisms. Negative organisms are thriving, good organisms are not. The cell therapy doesn't correct it. We have to correct it with ozone, medications, etc. So using donor cells, according to us, is not useful. First, they are donor cells, so we don't know where they've come from. We don't know the source. 2, they have artificial chemical in it called DMSO, which is a preservative, which can damage the brain. That's why we can't inject it into the brain fluid. We can inject it IV. Third, these are all cryo-frozen at -40, some very negative temperature, and they are kept for a long time. We don't believe that these cryo-frozen cells with a preservative that damages the brain from a source of cells which we don't know where they've come from, injected intravenously, not in the brain, because from there it goes to the lungs, from the lungs to the heart, and then it comes through a long route. I don't believe these are useful. I believe we should first repair the damage, and the gut has to be treated separately, which is what we do. So I am not in agreement with your status to do donor cells first, because they are not natural and we don't know where they've come from. The next question is, I understand the child is sleeping during procedure, but if the child was not sleeping, then would the procedure be painful? No. We sedate the child, so the child has to be sleeping, because when we do the procedure, the child can't be moving around. So we give what is called a short-acting anesthetic or mild sedation. So the child is sleeping and the child experiences no pain. The child will not even know what happened, because there is sedation, and there's also, with a thin needle, we give local anesthetic. So the local anesthetic makes that area numb. So the child has no pain. Yeah, so do I have data on effectiveness for fragile X? Yes, of course, we have treated several hundred children with fragile X. And for want of time, I can't present that data separately, but we have very good results. Again, we are not treating the fragile X. We are treating the brain damage caused by the fragile X. So that is what we are doing. But yes, we have some very useful data. All right, if this... my cousin is 30 years old with Down syndrome. Did you treat Maisha? What kind of improvement did you see in Maisha? So we haven't treated Maisha as yet. We just happened to have met her a week ago or so when we were in New York. So no, she's not our patient. They happened to attend the seminar, but we have treated so far little over 100 children with Down syndrome, and we've got very good results. Now, we are not treating the Down syndrome. We are not correcting the genetic defect of the Down syndrome. We are repairing the damage caused in the brain by due to the Down syndrome. So we've got very good results for Downs. Their intellectual disability improves, their understanding improves, their comprehension improves, they become more independent. For want of time, I didn't go into the details because Fragile X, Down, these are all separate subjects all by itself. But in summary, my answer is the results are very good. For those children who have been to stem cell therapy, now specs this new... 1 minute, I didn't understand that question. For those people who have been to stem cell therapy, how specs this new approach get combined? So we... if you've already taken stem cell therapy, you've taken it from us, we will be, whenever you come to us again, we will tell you what to do. If you've taken it elsewhere, we have our protocols, and if you communicate, reach out to us, we can tell you how you can combine. But we find the best time to combine is with the cell therapy. So you do the cell therapy, you do the HBOT dose just after that, you do the comprehensive rehab just after that. So it works together. It doesn't work as you do the cell therapy today and you do all these later. If the child has only speech delay and non-social interaction but no autism diagnostic, is still needed helpful. So what we do in such children who have symptoms but may not be classic autism, we do the brain scan. Now, if the brain scan is normal, then we will not give stem cell therapy. Then we treat with just hyperbaric oxygen, ozone, rehab, etc. But if the PET scan shows that part of the brain is not working, then we can start using, then we can do stem cells. So speech delay and non-social interaction can be treated after we do the PET scan. How does the child get antibodies at first? So basically, the children get antibodies because for two reasons. One is from the mother, because we found that the mother's level of folic, this thing is also very high, unabsorbed, inactive folic acid. Also, it's high in the level of the children because we are giving them supplements and the brain is not able to absorb it. So when there is too much of something in the body develops antibodies. It is a natural defense system. These levels are high. Let's protect the cells from a high level. So it's actually a protective mechanism. But once the things get blocked, now inactive to active doesn't happen. So the answer to your question is elevated levels, either in the mother or in the child, cause the antibodies. Tell us more about Leucovorin, how it works, doses, and possible side effects. So, like I said, Leucovorin is folinic acid. The thing about Leucovorin, it doesn't need the MTHFR gene to convert. It directly enters the brain. It's like one door is closed, and if you give regular folic acid, The door is closed for that. Leucovorin enters through another door. So it doesn't matter what the gene defective. That is how it works. With regard to the side effects, like I said, the main side effect is hyperactivity. So a lot of parents tell us, we we take the Leucovorin, the speech starts improving, but the child becomes aggressive, hyper, stuff like that. So that is the main side effect. The dosing, of course, depends on the body weight. So it's difficult to say right now. Each child has a body weight, and based on the body weight, we decide how much Leucovorin has to be given. How does donor cell chemical gel filtered out during thawing? Yeah, so first, we don't use donor cells. We don't use donor cells at all. And that the way the cells are sent, once you thaw them, so they're actually sent minus the gel. And you just have to, when you get the cells, you just put them in warm water and thaw them. So we don't use this, and primarily because of what you asked, questions like what happens to the gel. So we don't use it. So I really can't answer your question. We prefer regular cells. When a child is coming for the third or second dose, can he now combine the new medication, and how much will be the estimate for a combined therapy? Yes, we are doing that. So children who are coming back to us, we are combining all of this. So we weren't using all of this before, but we are now. So whenever you come to us again, we will be combining all these therapies depending on whether the child needs it or not. So we will do that. And well, the estimate is so nothing more is added. I mean, all these additional treatments we do, it's part of the entire treatment package. We never charge separately for anything. We don't charge separately for the Leucovorin, separately for this. It's part of the composite rehab package. I have 3 kids with autism and I've tried many different treatments. Nothing works. And have found their MTHFR gene. Yeah. So you've just, Peter, you just found that your child has a MTHFR mutation. Like we told you, we found 3 out of 4 kids. Out of every 4 kids, 3 have a mutation, 73%. So yes, if there is a mutation, we have to, give particular supplements in a particular form in the correct dosage. And of course, we find when you combine it with cell therapy and hyperbaric, you get the best results. Our best results are cell therapy, stem cell therapy, rehab, oxygen-based therapies, Leucovorin. Combine all of this, get like an amazing result. And yeah, Peter, to continue answering your question, like nothing was working because you didn't know they had an MTHFR gene problem. Now that you know it, and now that you know we have solutions, all the 3 children should do much better. How many times is anesthesia administered in total during the entire stay? So the anesthesia is given during the images. So there is the MRI and the PET. That is one set of anesthesia. And in the procedure, it's only twice. Once when we do the bone marrow aspiration and once when we do the injection. So anesthesia is given 2 times for the procedure. I plan to do a seminar. I plan to do a seminar or webinar only about causes. This will be helpful. At present, we aren't planning to do anything only on the causes of autism because it's like a massive, huge subject and it doesn't directly benefit our kids. I mean, let's say I tell you what the cause of the autism was in your child. It's not going to help the child to improve. Right now, our focus is let's get our kids to get better. Okay. I am not planning to do, but I could. If we have enough people and you want me to do a seminar on just causes, I'm happy to do that. So Peter says all your kids have very high levels of metal toxicity. Why metal toxicity in your child? I don't know. In a particular child, we don't know. There can be several causes. So I don't want to get into that without going through your history. But I am sorry to say that all 6 have heavy metals. But I can't tell you the reason because that'll require a lot of looking into. Are you still doing PET scans? Is there more advanced imaging now with SPECT scans? So no, we are still doing PET. In fact, SPECT, which you mentioned, is a lesser, it's an inferior version of PET. SPECT is called a poor man's PET, in the sense it's a simpler machine, it's less expensive, but it gives you very little data. So its spec is not an advancement, it is actually going backwards. So no, we will do PET scan and we will not do spec scan. Is stem cell therapy not sufficient? Why do we need HBOT? I heard from cases where by only doing HBOT. I don't know whether only HBOT helps or not, but what we found in our own data, so we till 2019, we were doing only stem cell therapy. From 2019 onwards, we give parents both options of combining with HBOT. Recently, we analyzed the data of the patients who had taken only cell therapy and the patients who've taken cell therapy with HBOT. The average improvement with only cell therapy was 87%. 87% of the patients improved. But cell therapy was combined with HBOT, 93% improved. That's a 6% difference. That is huge. So we believe the combination works. So the question was, is stem cells not sufficient? Well, with stem cells, 87% people improve. So it's obviously sufficient. But when you combine with HBOT, 87 becomes 93. Does iron infusion during pregnancy can be a problem? Maybe it is seen that iron infusion can cause some toxicity. So I can't say for definite right now, but yes, it could possibly cause. Is IV Leucovorin has better absorption. So presently we're preferring to use this only orally. It's simpler, safer. And, anything that can be given orally, there's no need to give it intravenously. Is the hyperactivity temporary? Yes, it is temporary. It is temporary. It settles down and soon they become okay. Is compounded Leucovorin a better option? See, the thing is that when you buy from a company, branded Leucovorin, it goes through an FDA approval process. So we know that there is Leucovorin inside that. I'm not saying compounded is bad, but at least in India, nobody is making compounded Leucovorin. It's like difficult to make. I believe in America, pharmacists do that. But my answer to your question is, it's not better because we don't know its quality. And it's just the raw material, the active pharmaceutical ingredient called API, which, by the way, 75 to 80% comes from China. That is the same. So my answer to your question is, better you take tablets which have gone through an FDA process than doing it by yourself. When I do by yourself means when you do it compounded. Is the hyperactivity temporary with side effects? Yes, the hyperactivity is temporary. It can last for about a month or so, then it goes away. It's counting. Ishta says, my daughter has been taking Leucovorin since March, had second shot of stem cells in Feb. She showed improvements in speech to about 5 months, and now it is plateaued. Yeah, so at least there was improvement. So the thing is, to go from 0 to 1 is the big thing. To go from 1 higher up is difficult, and that's why sometimes we have to repeat the cell therapy, and we have to also combine it with hyperbaric. So what I would suggest is, for the next time, with your cell therapy, combine it with HBOT and with Leucovorin, and you get much better results. Madela says, good evening. My son has virtual autism for 3.8 years. Can it be cured with stem cell therapy? So this word, we hear of this word virtual autism, but there is nothing scientifically like virtual autism. There is autism or no autism. Virtual autism, we refer to kids who are continuously on digital devices. But whatever it is, it can be cured with stem cell therapy, but we don't use the word virtual autism. But I know what you mean when you say virtual autism, and we can correct it. Anonymous says, inflammation of the brain, can we treat those with antibodies, antivirals? So the thing is, we don't know exactly what the infections are. Sometimes it's fungal, sometimes it's bacterial, sometimes it's viral. So until we have the reports, and at least the gut microbiome reports think about 6 weeks to come. So it takes a little long. And so the answer can be, there's inflammation in the brain. Can't we treat these with virus antibiotics and then opt for stem cells? Well, you could. I mean, you could. And there are many parents who do that. But since you're with us, let me go back. We do a gut microbiome test, but the report of that takes 6 weeks to come, and then we do the gut correction. You could do that before, and that's fine as well. But we believe doing everything parallel together is much more useful. We get faster results. But if you're saying, should we cleanse the gut first? Yeah, we're welcome to do it. It's just that you'll find it very difficult to do because it's difficult to get the gut microbiome, it's difficult to get ozone rectal, it's difficult to get all this. Once you're with us, we will do all of this together. Apurva is a pharmacist, Apurva is a parent of a child treated by you. She said the compounded Leucovorin is available if prescribed by a doctor. So will you guys prescribe it? Maybe it's available in the United States. We don't get compounded Leucovorin in India, to the best of my knowledge. If the quality is good, we would have no objection to it being used. Only thing is when it comes from a company, the company needs FDA approval, and the amount and quality of Leucovorin is checked before it is prescribed. So in India, we don't have an option. My preference is for manufactured Leucovorin, but if compounded Leucovorin is available and the hospital, the pharmacist, everybody, and the parents are okay, happy with the quality of it, we have no problems. Leucovorin is Leucovorin. To us, it doesn't matter how you take it. So to answer your question, if you're sure of the quality of compounded Leucovorin, please go ahead and use that. We just find it simpler and safer to prescribe it. Another parent, Dr. Sandhya, has a long list of supplements. Do you like to follow the same path for supplements? So we are aware of Dr. Sandhya's work. She has done some amazing work. We are very, very impressed with what she's done. We've had several hours of interactions with her. What we do is we do a biochemical evaluation. We check which micronutrients, supplements, or vitamins are less, and we correct only those. So our treatment protocol, and this is recent in the last 2 years or so, is based on identifying the deficits and correcting it, not giving, having a one size fit all. Now, Dr. Sandhya is in a unique privileged position because she's a doctor herself. So she has the freedom and flexibility of being able to give her daughter various treatments, because as a doctor, she can monitor it. We know very often that when she's using a medication, she has seen, when she sees side effects, she knows it is because of overdose and she can pull back. This same thing can't be done by regular parents. So to answer your question, we believe supplementation should be done for those things which are deficient. Okay. We don't believe supplementation should be done without proper diagnostics. That's our simple take on it. How long is the whole treatment process, and do we have to how long? So We have two options. We have a 1 week option and a 2 week option. Somebody asked for how long the treatment process is. In the 1 week option, we do the brain evaluations, biochemistry, we do the stem cell therapy, and we do rehab. In the 2 week program, the hyperbaric oxygen, the ozone, the gut cleansing, aquatic therapy, a whole lot of things are added to the 2 week program. So that is the difference. So it's either 1 week or 2 weeks. Veena, are all your patients now getting cupping ozone? Yeah, well, right now all our patients are getting. We find cupping ozone to be very useful. We found speech is coming a little faster with that. Yes, you asked, is Leucovorin a long-term medication? Yes, unfortunately, it's a long-term medication. But we've had people who are, after using it for about a year or so, once their child went off the spectrum, but these are children who took cell therapy, HBOT, and Leucovorin. We found that they've been able to stop it and they don't have to take it for a longer period. Okay, I think with that I answered all the questions. If there are any more questions, please ask. I'm still watching, otherwise I will end the seminar. Okay, looks like there are no more questions. Thank you so much to all the parents for attending this webinar. I hope I could clarify some of the points. If not, I'm always available. I like you to know that you can set up a virtual consultation with me. It's free of cost. It's a half-an-hour consultation. 15 minutes is done by the junior doctor who takes your history, and 15 minutes with me. So to all of you who have attended the webinar, if you want to talk to me 1:1, we can do it over a virtual call, which is free of cost. I'd like to, if you have the number of Sunita, maybe we'll put it up here. Otherwise, I'll just share another number. I'll just say it, or maybe I can type it as well. So you can contact Mamta, who's our executive assistant, and her number is +91. I'll repeat the code for India, +91. And after that, 90900 33336. I'll repeat that. +91 90900 33336. So if you contact her, she can set up a virtual consultation with me. I'm available this coming week. After that, I'm traveling a bit for the next 2 weeks, so I'm happy to do 1:1 consultations with you. Like I said again, they're free of cost, but we will run through your reports. You can send us videos of your kids, and we'll be able to answer your more specific questions. All right, with that, thank you for your attention, and I look forward to seeing all of you. Yeah, take care.